We know that early detection and treatment of health problems typically reduces complications and leads to improved health outcomes. Yet, currently only 21% of preschool-aged children are screened for vision problems, although policies and guidelines exist for screening of all preschool-aged children. Primary care physicians and other healthcare professionals have the most regular contact with preschool-aged children. Well child visits provide an excellent opportunity for the early detection of vision-related problems in children. It is during these well child visits that children should receive an evaluation of their eye health, including an overview of family history, objective vision screening, and physical assessment of the eye. These vision assessments should occur in accordance with the schedule outlined by the American Academy of Pediatrics in Recommendations for Preventive Pediatric Health Care. Further, during each well child visit, anticipatory guidance should be provided to parents and caregivers related to eye health and injury prevention. For children who require additional evaluation after vision screening and assessment, the medical home serves an important role in coordinating follow-up. Although screening helps determine which children might have an eye disorder, a comprehensive examination is necessary to make a formal diagnosis prior to initiating treatment. For an office-based screening program to be successful, patients must receive appropriate and timely follow-up services. Primary care office staff should prepare for a vision screening by looking at the usual flow of well child visits for preschool-aged children. Vision screening is most likely to be successful when the child is comfortable and before any potentially upsetting procedures are performed. For example, a medical assistant might plan to perform vision screening after taking an initial history and completing the elements in a chart required for that day's visit. If the child seems cooperative, doing height and weight measurements would prove to the child that the medical assistant is friendly, but taking a blood pressure might be postponed if it seems to threaten the child. The office space should be arranged to facilitate completing all the procedures as comfortably for the child and family as possible. Be sure that the office is set up in advance with attention to the following items needed for conducting vision screenings in the healthcare office setting. Choose a room or space for administering the vision screening that is free from distractions and interruptions and well lit. The space also needs to be large enough to accommodate the recommended testing distances. Obtain and install all appropriate screening equipment in the designated vision screening space. Establish a recording area on the patient's chart for all vision screening related data. Purchase educational materials for distribution to parents and caregivers. Train and evaluate each person in the office who's involved in vision screening on his or her screening functions. Educate the appropriate practice staff about the proper use of Physician's Current Procedural Terminology, CPT, code 99173 for vision assessment. Teach appropriate staff about the value of follow-up procedures. Train and evaluate appropriate staff on performing the follow-up procedure for vision screening outcomes. Familiarize all office staff with the forms, questionnaires, and postcards that will be used to contact children's parents and caregivers about any additional eye care indicated by the screening. Determine a physical location suitable for setting up the vision screening equipment. Pay special attention to the lighting needs of the vision screening space. There should not be any glare on the screening charts or stereopsis cards, nor should it be too dark for the child to see the chart or stereopsis card. Select a wall for the chart or commercially available illuminated light box for vision screening that ensures an unobstructed view for the child. Make sure that the wall is clear of distracting colors and pictures. Ensure that the room size is adequate for measuring off the distance between the chart and where the child will be for the screening. Make sure that the space will be free from traffic and other distractions during the screening sessions. Measure and mark appropriate distances and heights to do the screening. Hang the eye chart or illuminated light box on the wall with the midpoint of the 2030 and 2040 lines approximately 42 inches from the floor, about the eye level of a standing preschool-age child. Measure off the 10-foot and 20-inch lines and mark the distances with masking tape or the happy feet. If a line on the floor is being used, place the child's heels on the 10-foot line for the visual acuity test. The examiner stands at the 20-inch line for the stereopsis test. Have stereopsis materials, acuity practice cards, recording forms, alcohol swabs, an occluder, and a wastebasket set up in the screening space for ease of use. In the waiting room, give the parents or caregivers a practice card for the appropriate vision screening chart and ask them to review the shapes and practice with the child while they wait. The vision screener has the following responsibilities. Take the parent and child to the vision screening area, review and complete the parent questionnaire, and note any family history of vision problems or other risk factors. Observe the child's face and eyes and note results on the recording form. Perform visual acuity screening and note results on the recording form. Perform stereopsis screening and note results on the recording form. Flag any results or concerns that the physician should discuss with parents, and educate parents about the importance of routine vision screening done in conjunction with well child care in the medical home. The physician has the following responsibilities. Review family history and screening results with parent or caregiver. Physically observe and examine the child. Eye examination should include external inspection, ocular motility assessment, pupil examination, red reflex assessment, cover and uncover testing, and an attempt at ophthalmoscopy. Perform additional or repeat screening procedures as necessary. Determine whether further evaluation by an eye care professional is needed based on the family history and screening results. Discuss appropriate course of action with parents or caregiver and provide educational materials and financial assistance resources related to eye care. Instruct staff to fill out the appropriate follow-up correspondence for parents and caregivers. Ensure the quarterly reviews of screening protocols are initiated to refresh the screener's practices. Initiate quarterly checks to monitor the integrity of the screening process and equipment. Children, especially very young children, may not sense or complain about discomfort or visual difficulties. Parents and classroom teachers may have picked up on various signs or have noted comments from a child to indicate a possible problem. Observation of any of the following signs is sufficient reason to refer a child for an examination. In such instances, it is not necessary to proceed further with the screening. There are 3 types of signs of potential vision eye problems that screeners may observe in children. Thinking about these 3 ABCs, appearance, behavior, and complaint, can help the screener with this initial observation. The A, or appearance, is how the eyes appear upon visual inspection. Are the eyes crossed or wall-eyed? Do the eyes water? Are the child's eyelids red-rimmed, encrusted, or swollen? Is an eyelid drooping? This is called ptosis. Is there a sign of a stye, an infection on the eyelid? Is there a presence of a white pupil? This may also be observed on a photograph and as a possible sign of retinal blastoma. Is there a possible eye injury? Watch for eyes that are reddened, bloodshot, blackened, bruised, or swollen, or evidence of lacerations